Here the first thing that you see is there will be redness and in duration slight raised skin like a mosquito bite, okay, but it occurs immediately within 15 to 60 minutes. So let's say if you have pricked around 10 allergens, only one of them has this response, it means the patient is allergic to that one. The rest of that will not have any response. But the main point is it is because of Th2 cells. Okay, IgE mediation and mast cell coating and histamine release. Then there is a late phase as well. Same patient, you ask him to go home and can come after 1 day. So after 48 hours, 36 hours, you again check, you will see that there is increase. So that is the late phase. So in the first phase, histamine was released. In the late phase, prostaglandins, leukotrienes, and cytokines are released. So this will continue. On the contrary, if you see a patient of delayed hypersensitivity, all of you have talked about tuberculin skin test which is done for tuberculosis. In that, again, there is a small, pricking instrument that you just press on the forearm and encircle the area. But that is basically one thing that has been injected. And then the patient is asked to come after 36 to 72 hours. Hours later, 48 hours later, you can check it. Initially, first at least 12 hours, there will be nothing. So that's the big difference between these two tests. The initial, the priming or the starting caused by the type 1 hypersensitivity, it is an allergen, while in case of delayed, it is PPD, purified protein derivatives from mycobacterium. In first case, it is caused by Th2, while in tuberculosis, it will be caused by which cells? Th1. So it's all Th1 mediated delayed type hypersensitivity. In first two reactions, in the first 12 hours, you will see the response. After 60 minutes, after 12 hours, but in tuberculin skin test, it has to come later, after 36 hours, after 48 hours. That's why it is called as delayed, while the first two are called as immediate. The last one is also an alternative skin test. It is also done for allergy. That is just like a tape. You can on the back of patient put a tape, leave it there for 10-15 minutes, then remove it, and after 15 to 60 minutes you will see erythematous patches. How they look, I'll just show you quickly both of them. So this is the wheal formation in allergic patients after just 15 to 20 minutes, and this is the erythematous patch made again on allergic patients. So these both occurs in around 1 hour, within 1 hour. Now we'll see that what are the different treatments that you can provide a patient of allergy. So first thing is, if you look at the bottom, there is the reason, or what you have to do, and here is the starting thing. So step by step, the allergen has entered, allergen is here. First thing is, if it is possible to avoid it, if somebody is allergic to food, allergic to pollens, cat, dander or whatever, tell them to avoid it. That's the first thing. Number two, you can give them monoclonal antibodies that can block the IgE antibodies. So the antibodies that are produced here, IgE antibodies that will coat the mast cells, you can block them with some other antibodies. You inject those antibodies, they go and block them. So let's say there is a mast cell. This mast cell has got antibody on it, IgE. Now you bring a monoclonal antibody, another monoclonal antibody, IgG, it will come just block it. So what is the benefit? It will not allow the coating of the allergen to it. Okay, so that is one treatment for it. After this, mast cells, so the response is mast cells will release the histamine and bradykinin. What if we ask the mast cells do not release? There are certain drugs, for example, sodium chromoglycate, it is called as mast cell stabilizer. It stabilizes the mast cells, even if there is a triggering factor, for example, in non-atopic allergies where cold air or vancomycin or dyes, they were causing the degranulation. You give them this mast cell stabilizers, then the mast cells will not release the mediators. So that is another therapy, mast cell stabilizers. Another thing, mediator antagonists. So you give them antihistamine, for example, chlorpheniramine, or you give them epinephrine to block the effects, to antagonize or block the effects of the mediators that are produced in IgE, mediated allergies. And you can see it can be used in a range of conditions: allergic rhinitis, food allergy, atopic eczema, or asthma. In any of these, you can use these different therapies. Now there is something different that is applied in lately, which is if you give the patient higher doses of allergen. Normally very small quantity of allergen goes and it causes allergy. So what if you give them constantly, gradually, and keep giving them allergen exposure? What will happen? There is something very interesting happening. Normally you can see it's just the whole thing that I have explained here, that TH become TH2, TH2 helps the B cells in producing antibodies, they coat the mast cells. But if you give them more allergen, they start producing IgG4 instead of IgE. And what will that do? That IgG4 will bind to all the allergen and it will be taken up by the macrophages. So kind of like scavenger receptors who go in, clean the allergen and take it away from the system. So is it used nowadays? Yes, the answer is it is called as desensitization. This particular therapy is given and it's called as desensitization. Who are the patients for this? Who have too much allergy and their quality of life is disturbed by the allergy too much. They go to the specialist allergists. They give them subcutaneous injection of the allergen. So first what they will do, the patient go to them, say, I have got, let's say, allergy to, in this season, it's a seasonal allergy. They find out which allergen it is. Is it pollen, it is dust, it is cat dander. After identifying that, they give them subcutaneous injections regularly. It's a treatment of around 2 years, and initially the injections are more frequent. Later on, the space between the injection is spaced out. So if you look at up, first thing is in blue line, allergic injection. So this is an injection given slowly in the initial phase. There are a lot of injections given, subcutaneous injection. Later on, the space is increased between the injections. Initially you can see the symptoms were quite a lot. Gradually you can see the symptoms are reducing over a period of 2 years. Same thing is here. You can see initially IgE antibody, this green color was quite high, but slowly IgE antibody is dropping and IgG4 antibody, it's increasing. Here it has increased very high levels, and this increases sometimes 10 times more than the normal IgG in the blood. Okay, so subcutaneous injections are removing the symptoms and improving IgG4, which neutralizes the allergen and takes it out of the system.
Is IgG4 harmful for the system?
No, because its job is only to find allergens. It's specific against the allergens. So, do you have any questions regarding type 1 hypersensitivity so far? Yes, please. No, it will go and find the allergen. Wherever is the allergen, it will bind to it, and then the macrophage will take this immune complex. Because normally, immune complexes are formed all the times in your body. Whether it is a viral infection or a bacterial infection, they have to be cleared from the system. Who do this clearing? Macrophages. They have to engulf like a vacuum, clear the system. So this therapy relies on this particular function, that you give them this allergen. As a result, natural IgG4 are produced. They will search for the allergen. Whenever they find it, they will capture it. Macrophage will engulf it, and then the macrophage will just destroy it. Any other question? You all look so overburdened. There's one part still remaining, so kind of you ask few questions, maybe that will cheer you up, you will feel a little happy, and then we continue with the remaining part. Or you are ready to take on the remaining. Okay, so delayed type hypersensitivity is called delayed type because of it takes more time. Let's see if you can finish this second part with me. Maybe it will wake you up, all of you. So delayed type is called because it takes more time. Which cells are involved? TH1. Type 1 is TH2 mediated. Type 4 is TH1 mediated. So it's a slow process. TH1 and TH1 is helped by which cells? So TH1 cells will produce interferon gamma. That interferon gamma will activate macrophages. They will also activate which cells? They will activate everyone. They will activate B cells to produce which antibodies? IG. So here in a TH1 response, the dendritic cell takes the antigen with the help of PRR, present it to TH1, and it will produce a cytokine that will make TH1 TH1. Which cytokine is that? Excellent, it is IL-12. And the special quality of TH1 is that it produces interferon gamma. That interferon gamma will order B cells, that will order macrophages, and that will order natural killer cell. The order to B cell will be what? To produce another type of antibody. Which antibody? No, it is already producing IgM. So all B cells are producing IgM. They have to convert into and IgA, because IgE is the function of TH2. So TH2 deals with IgE, TH1 deals with IgG and IgA. Interferon gamma information to macrophage. What is the information? What is the order? Start killing. Start producing what? Nitric oxide, hypochlorite, all these things will be produced by. What is the order to natural killer cell? Kill more, be effective killer, and increase the expression of receptors. So basically TH1 is doing all these. And did we miss something here? Excellent. Cytotoxic T cells, CD8 cells. That's actually the main function. CD8 cell will become what? Cytotoxic T lymphocytes. So now the T lymphocyte cause tissue injury by two ways, either by triggering inflammation through cytokines, or through CD8 cells, which will cause direct damage to the cells. Now there are three variants of type 4. One is called as contact hypersensitivity, one is called as tuberculin reaction, and one is called as granuloma formation. We have seen two of them already, tuberculin and granuloma with respect to tuberculosis. Just one addition is today, and that is called as contact hypersensitivity. So the time duration, if you look at, is all are after 48 hours. So it's a delayed response first, whether it is contact hypersensitivity or tuberculin. But for granuloma formation, 21 to 28 days. So the time taken for granuloma formation is too much. This plant called poison ivy, normally in the West, when people go for hiking or picnic, this plant is too much in their environment, and when you just come in contact, just brush off against your skin, the allergen enters the body and it results in contact hypersensitivity. We'll see why. You can see that a vesicle, fluid-filled vesicle is formed. Why there is fluid-filled vesicle in contact hypersensitivity, and then this the tuberculin reaction has got an induration, a raised area. So just to clarify these 2 points, I'll tell you the steps, and then you will remember it, that why there is one has fluid-filled vesicle, one is just induration, hardening of a small part with redness, and granuloma formation is very hard, thickened skin, but mainly it can occur inside the lungs, it can take place inside the kidneys in different parts. So we'll see first the contact hypersensitivity with poison ivy. So this again also has sensitization and elicitation phase, like type 1 hypersensitivity. First, what is occurring before understanding this, skin has got different layers. There is epidermis, there is dermis. The epidermis has got lot of layers. Do you remember any? Epithelium, then there are keratinocytes, then what else? There are 6 layers. Stratus spongiosum, stratum granulosum, and blah blah blah. So anyway, epidermis is very thick, and this particular reaction, contact hypersensitivity, it is in the epidermis. So there are dendritic cells in the epidermis. They are called as Langerhans cells. Allergen, so the plant brushed off against the skin, it will go inside the skin, and it will be taken up by the dendritic cells and also by the keratinocytes of the epidermis. Okay, so now the allergen is inside the keratinocytes and it is inside the dendritic cell. Dendritic cell will take it to the closest T cell area, okay, which is in the dermis. There they will find the T cells and they will activate them. This whole thing, Th1 will be activated, Th1 will produce interferon gamma, they will activate macrophages. Now this elicitation phase, the sensitization phase has completed. What happens next time? The patient again is exposed to the allergen. Now they have got activated Th1 and they have got macrophages. Okay, both of them, they will go into the epidermis. So this part, this macrophage and this T cell, they both are activated. They go into the epidermis, and where is the allergen? In these keratinocytes. Yes, is it correct? So the allergen, I told you that it will be taken up by the dendritic cells and it will also enter these keratinocytes. So allergen is here. These macrophages and activated T cells, CD8 cells, they will come and start destroying the epidermal keratinocytes. So what will happen? That multi-layer keratinocytes, they are destroyed, they loosen up. There is space created, and that space is filled with fluid. That's why you have got fluid-filled vesicles in these patients. Because of so keratinocytes hold together very tightly. That's why there is no space. But when you destroy keratinocytes, some of the cells, the space will be created and it will loosen up, and their fluid will go and it will create vesicle. Now this is the whole thing. Who are involved here? You can see this top cell is the keratinocyte. He has got the allergen inside it. This is the dendritic cell. They have captured it and activated the cell, and the macrophages are also involved. But it will occur as long as the allergen is there. Once the allergen has been destroyed, or once the cells that have got the allergen, they have been destroyed, it will not continue forever. Then after this, there is a suppression phase. Once the allergen is gone, the new other healthy keratinocytes, they will produce certain cytokines called prostaglandin E, and some macrophages, they will also produce prostaglandin E, and the whole phenomena will subside. So in the end, contact hypersensitivity subsides by itself. It does not require medication. And tuberculin skin test, that is, as I already said, the BCG the purified protein derivative, it is injected into the dermis, and that will result in what? Now here the dendritic cells are in the dermis, they are not in the epidermis. This is the difference between the first contact hypersensitivity and tuberculin reaction. One is in the dermis and the other one was in epidermis. They will take the antigen, present it to the cells, and as a result, macrophages and activated cell, they causes inflammation in the dermis. Okay, and what you see in the end is just reddened, hardened, elevated area. And finally, granuloma formation, that is similar to this whole phenomena. Th1 cells will produce lot of interferon gamma, and that will activate macrophages. But if you remember, I told you, mycobacterium, he can hide inside the lysosomes, and the fusion of phagosome lysosome is inhibited. As a result, what happens? It stays there for very long time. It can also block the receptors of interferon gamma. In the immune response to bacteria, we discussed the different ways Mycobacterium tuberculosis is preventing its damage. So what the body knows, that there is Mycobacterium in the body, inside the tissues, but it's still not destroyed. So T cell keep on producing interferon gamma. It keep on bringing more macrophages. Those macrophages start to join together and make these multinucleate giant cells, and they will surround the area where the pathogen is there, and this all thing will result in granuloma formation. So now you can see what you have learned by the end of this session. So what mechanisms are involved in hay fever, atopic dermatitis, and anaphylaxis? Yeah, through Th2, it is type 1 mediated hypersensitivity. What are the clinical features and management of acute anaphylaxis? Yeah, what did the doctor did with his wife? Epinephrine and chlorpheniramine. Those two, one is intramuscular and one is IV. So those were of acute anaphylaxis. When severe reaction take place, that is what you do. Then how may such sensitivities be detected? What can be done to desensitize the patient? First, how to detect it? How you will detect allergies? Okay, one more thing. When you do blood CP, can you detect allergy? Yes? What you will see? Okay. Can we measure mast cells? No, because mast cells are in the tissues. Basophils. Yeah, basophil will give you a hint that there is possibility of allergen. But what if I say you that that patient has got parasitic infection, not allergy? Yeah, eosinophils are also raised in allergies, because this IL-4 which is produced in Th2, they will cause eosinophil raise as well. Okay, what about antibody detection? Yeah, which antibodies you can detect? IgE, very good. You can detect total IgE and specific IgE. Now there are tests where you can detect whether is IgE against pollens, IgE against this. But is still this specific very good enough to tell you? No. The gold standard for checking allergies is skin prick test and the patch test. These are the gold standards. And we saw both of them, that you inject the allergen and then read it after how much time?
3 days. 1 hour.
No, 3 days is for tuberculin test. Skin prick test has to be very fast. That's why it is called as immediate hypersensitivity. 1 hour. After 1 hour you have to read it. While the tuberculin test, that you have to read after 3 days. Then what is desensitization? Giving them high dose of allergen. Initially give them lot of doses, then space them out. It's a treatment of around 2 to 3 years. What happens to IgE antibodies?
Replaced with IgG.
Excellent. They will be replaced by IgG4, and IgG4 will do what? They will, yes, they will complex with the allergen, and then macrophages will take these complexes. What are the 3 different variants of delayed type hypersensitivity? Name them. Tuberculin, contact hypersensitivity, granuloma. MashaAllah, you have already learned everything. So that's it for now. Thank you.